Hi, here's my working station for 2 weeks. This is the injection preparation area where there are surgical spirits, hand sanitizer, syringes and needles of various sizes, sterile cotton and trays, and an ice box to store test dose injections, opened and unfinished rabies antiserums. I had day duty on this day, so I'm preparing the injections for a new patient. In this community medicine clinic, we take history and write the prescription forms first. And then the required injections are given, which are mostly rabies vaccines. By the way, have a look at this. Cool, right? Here's another one. Did you see that? Anyways, after this, I was told to sit at the front desk to take patient history. By the way, I only film when the duty isn't hectic. Here are other vaccines which are also given, such as HRIG, RMAB, to those who can afford it, Hepatitis B, Tetanus toxoids, and other special vaccines which the patients buy and bring with them. So we have to be extra careful while administering it. Moving on to a night duty. After taking the injections, many patients have to wait, so we usually turn on a movie for them. I offered them and the bystanders some snacks to make the waiting game less boring. Also made ramen after discharging all the patients that night. I had a solid 3-hour sleep and then woke up at 6:30 a.m. to restock the injection preparation area. There are usually 90 to 130 patients per day, and while some need only 1 injection, others might need more than 2 injections. Then I checked the temperatures of all the fridges that store vaccines and recorded it. Then I discarded the unused vaccines and changed the ice pack from the ice box. Now I'm preparing a fresh injection of rabies vaccine and a test dose for the day batch.
Oh, because of ma'am. Oh. I only.
After night duty, the doctors get a 6-hour break, and then a half duty for the next 6 hours until the night batch arrives. This evening was less hectic, so I decided to make a fresh test dose with normal saline so that the night duty doctors wouldn't have to. It can get hectic at night sometimes because usually patients who are office workers or staffs would come around this time after completing their works. So making a test dose beforehand can make their duties a little easier. And don't worry, we're all friends, so they do the same for me also. This was the last day of CMC, and I gotta say, I learned a lot here in the past 2 weeks. That night, we all doctors went out for a dinner treat together. Thank you, CMC, and thank you for watching. Take care and all the best.